Cause your time is money and I won't let them waste it. Oh no, no. Baby, just go with it.
Hi guys. I'm at the hospital with a friend. She just had the gastric sleeve, right? The gastric sleeve, weight loss surgery. She is a few hours post-op. It is 10:30. Her appointment was at 7:30. So 15 hours post-op. I want to document this journey because she's not feeling well right now, but I want her to look back on this and see how far she have come. So, oh no, it's not on you, it's on me. I'm not gonna put her up here, y'all, because she, I respect people's wishes. Oh Lord. What did it say? Oh, the battery. Hold on, y'all. I'm on duty right now, so hold on. Okay, guys, I'm back. Nurse on duty. So, like I was saying, I want to record this because I want her to look back on this and her see how far she's come. Can't go back. Can't undo what's already done. So, how long was the journey? So it's a process that you have to take to get to this step. I don't feel like this is the easy way out because a lot of people feel like this is the easy way to weight loss. Weight loss is extremely difficult to do it on your own. Now, y'all know me, if y'all been following me, I didn't gain about 30 pounds, but I'm gonna get back on it. So it's just difficult. It's very difficult. But anyway, yeah, she got the gastric sleeve. How long was your process? Like from start to end? We'll go deep into the process another time, but like from the time you actually decide to do it, going to get all the follow-ups and cleared by all these doctors and stuff, we should say about 6 months. 6 months, but it depends on how fast the doctors can get you in and stuff like that. But if you have sleep apnea, you got to go to a sleep study specialist. Cardiac problems, got to get cleared by a cardiologist. If you have like a difficult intubation, got to be cleared by an anesthesiologist. So it's a upper GI. So it's a lot that comes with this process. So you got to be mentally prepared to take on this journey. And because once it's done, baby, ain't no going back. But I just want to show y'all a little bit what she has to drink. So 1 week prior to her, I'm gonna just do like a little synopsis right now. What happened? Oh Lord. I'm gonna just do like a little synopsis. So this is just like a little quick little, hey, friend got surgery here with her. But later on, once she recover and get better and she's up to talking if she wants to, we'll go deep into it. But if not, I'll go deep into it. I feel like this is very important to document because a lot of people just need to know the ins and outs of weight loss surgery. Because right now, she don't regret any regrets. She say she didn't have no regrets. Now she's saying she do, but she has been very, very nauseous. And of course, 1 week, that's why I was saying, I'm gonna tell y'all more about the surgery and the process, stuff like that. But 1 week prior to this day, so she had surgery today was January 9th, which y'all, she came to my birthday dinner. She was a trooper. She's so nice. But week prior to your surgery, you have to, have to be on a full liquid diet. So last Monday, she had on the January 2nd, she had to start her full liquid diet. The full liquid diet consists of like anything that could melt at room temperature, right? Clear, full liquid, not clear, full liquid. So like broth, low sodium, water, zero sugar Gatorade, popsicles, sugar-free popsicles, sugar-free Jello, not smoothies, but sugar-free pudding. And protein shake. That's what I was gonna say, protein shake. So you can have all that stuff 1 week prior. And I will probably post something right here to show y'all like just a little list of what you can have. And I think every doctor is different. Every Bariatric surgeon is different. So it just depends on the facility you go to and depends on how they want you to do it. Y'all know Dr. Nazalin. This facility, they don't really have patients that's like 700 pounds. So their diet, of course, would be completely different from somebody who's maybe 40, 50 pounds overweight compared to 500-600 pounds overweight. So her post-op is not as extreme as those who are on my 600-pound life. But her post-op, she has to drink, I'm going to show y'all the little medicine cups. We got to drink 4 in an hour. 4 every hour. So like the little medicine cups, I'm going to show y'all. Every 15 minutes. Which she's been having a hard time doing because she keep throwing up. So that's been very difficult. I used to be a post-surgical trauma nurse, and I had bariatric patients on my floor, and they usually do good like the first day. They usually go home the day after. So basically she has 24-hour observation. So she came in for surgery, had to be at 5 o'clock. Then she had surgery at 7:30. That lasted about an hour and a half to 2 hours. Then she had to stay in recovery about 2 hours. Once she was stable, she had came to her floor. So she's observation for 24 hours. So I think in order for her to go home, she have to pee, but she's been peeing on her own. And they took her Foley out while she was in the OR, while she was in PACU. And we have this thing called the Peerwick, which I don't know if y'all know what it is, but I can insert a picture right here. It's basically hooked up to a suction canister. And instead of pee getting up, you just pee. It's like a little cylinder that you put between your legs, and you turn the suction up to high in it while you pee, it suction it out. But because she need to go home, she got to pee on her own. And of course, post-surgery, any surgery, I get up and walk because you want to prevent blood clots. And she has an insensitive spirometer that she has to use to open up her lungs and prevent pneumonia and decrease her temperature. So all that stuff is important when it comes to post-opically. So that, y'all think I miss that? I keep my babies full time. But what I was saying. So yeah, so 24 hours observation. Her pain. So one thing about surgery, your pain can be confused with your nausea because she hasn't eaten anything. She's just been drinking. So she done threw up everything that she done had on her stomach. So basically she dry heaving and nothing is coming up but like spit. And when she try to sip, let me not say drink, she try to sip on her broth or try to eat a little piece of jello or water, she can't tolerate it. So the nurse did give her, which she's awesome, the nurse did give her some Dilaudid, which is a strong pain medication. It's stronger than morphine and roxicodone and oxycodone. Dilaudid is like one of the strongest ones on the inpatient floor. And she gave her Zofran. Zofran you can get with Dilaudid because Zofran is not as strong, but sometimes Zofran don't work. So she was gonna give her Phenergan, which Phenergan is a more potent, strong antiemetic drug, which helps with nausea, but you can only give it like in the AC or like a bigger vein because it can burn your vein and mess your veins up, but you got to push it very slow. And you're not supposed to give Phenergan and pain medicine back to back. You got to wait at least an hour-ish to give it. But she has fluids running because, of course, post-operatively, you cannot drink a lot to keep yourself hydrated. So she does have fluids running. I think she has lactated ringers. Depends on the surgeon. Some people have normal saline. Some people have lactated ringers. It just depends. Prior to this, she had lab work done. Of course, you had to lose weight. You had to either stay within the bracket of your weight before your post-op. You couldn't gain weight, put it that way. You couldn't gain weight. So she met that. But right now, she's on the edge of the bed. I told her 2 months from now, especially 6 months from now, it'll all be worth it. Right now, you're just going through the motions post-op. She ain't even 24 hours post-op. So she just now 15 hours and some change post-op. So I think she's doing pretty good. So yeah, she said the Dilaudid helped you. She said the Dilaudid did help. Her pain was a 9 out of 10. What's your pain now? So before the Dilaudid, her pain was a 9 out of 10. Now her pain is a 5 out of 10. And she got her dilaudid maybe 35, 40 minutes ago. The nurse did say that she was going to come back in here and give her Finnegan, no, her Zofran, if she's still nauseous, which she haven't really thrown up since she had her dilaudid. So it could have been that the pain is causing her to be nauseous, and both from just being confused at this time. So that's what probably happened, because I feel like when you're not in that much pain, you're not nauseous. So hopefully that dilaudid work and she could progress and move forward. But yeah, I was telling y'all what she had to do to get discharged. So the doctor did come around and say that the expected discharge is tomorrow on the 10th, when they make their round. So basically she have to keep her fluids down, number one, because when she get off that, so she's having IV fluids right now, which is keeping her hydrated, keeping her peeing and all stuff like that. So when she get off the fluid, she have to pee. So she have to keep peeing because she's peeing now, but she's peeing because of the fluids that's running in her. But she have to pee on her own consistently, not just drops, but like a regular pee cycle, whatever. I think nausea is expected, but not as bad, because you don't want to go home and you just throwing up, you can't keep nothing down, and then you don't got no fluids. Won't got time for that. So she had to walk. Well, she's walking. She did 2 laps around the unit, keep her water down or food down, and then pee and make sure her pain under control. Did I miss anything? All right, so now I'm gonna show y'all the incisive spirometer, which is very important to have post-operatively. The broth, which I think they need to put 2 more packs, because when I had my patients post-surgical, I used to give them 2 packs because 1 pack is like nasty. But considering she just had surgery, maybe 1 pack is better. But I'm about to turn y'all around to show y'all kind of some stuff that, not her, but kind of show y'all some stuff that she has post-op, bariatric, the gastric sleeve. All right, guys, so that's, of course, is the vomit bag. I forgot what we called that, girl. Can't think of it. Mrs. bag, the vomit bag. So this is the incisive spirometer right there. They want you to get what? They want her to get at 700?
I just made that.
Oh,
My goal.
typically at least 15 to 2,000. That this is what keeps your lungs open. It's good post-surgery, post-op. Keep your temperature down. Prevent collapsed lungs. Okay. That is the front of it. These are the medicine cups that she has to put the liquids in. So that's her broth. So she put the broth or the water in the medicine cup, and these are all the ones she's drinking so far. That is Tylenol, but of course she haven't had none on her stomach, so she's really not gonna take that. So the nurse gave her that, like I said, and that's her pudding. I mean her Jello. And these are the Crystal Light packages. As y'all can see, those are the 0 sugar, 10 calorie ones. I actually like those, what you call this, or whatever. This is the lactated ringer she's on. So she had a full bag down. She's almost at a half a bag. So I don't know if they're gonna change that once she finished. That right there, that is the urine, but that's the period I was telling y'all about. That's what the period. I think I just cut myself off. That's what the period is hooked up to, and the pee goes in the canister. This is the SD pump, and I can kind of show y'all a demonstration of how that works. So basically she puts, I don't know where they at. Oh, these things right here go around both of her legs, and then you hook them up to this. You cut it on, and it squeezes her legs to keep the blood pumping and flowing. So that way, if she's not walking, if a patient is not walking, let me tell you. So if a patient is not walking, they put those on and it pumps her legs. So at nighttime, they'll probably tell her that she has to wear them because, of course, she might not be getting out of bed as much in the middle of the night. So she'll be having those on to help to keep her blood circulating. Oh, she also had to get Lovenox injection. You get Lovenox in the hospital? She had to get her Lovenox injection. It might be every 12 to 24 hours. I don't know. But she get it while she is in the hospital, and that is to prevent blood clots post-surgery. So she get that, and she have to take it when she go home as well. How many days you got to take Lovenox? 7 days post-op. So basically, it's just a shot she give anywhere, subcutaneous injection, sub-Q injection, where you pick any fatty part of your body, behind the arms, your stomach, back of your thighs, any fatty part, typically in your stomach. But if you then poke around too much of your stomach, because it can cause some type of bruising in your stomach if you keep poking the same spots, so you want to rotate the spots. So back of the arm, your thigh, or your stomach for the Lovenox injections. I think that's it. So we'll keep this journey going, and I'll talk to y'all shortly. Oh, I'm not gonna put the camera here like I said, but I asked her anything she want to tell the people, and you say what? She's nauseated. That has been the number one thing that she just have been having issues with, just being nauseous. But that is one of the side effects of anesthesia. So if you are considering some type of cosmetic or elective surgery, or when you have to have a procedure, you have to go into general anesthesia. That's general anesthesia, not local. General and local anesthesia are two different things. So if you have to go under general anesthesia, sometimes nausea and vomiting is, ain't no sometimes, it's very common with general anesthesia. So, and then on top of that, she can't really eat anything, because a lot of times when you have surgery, not bariatric surgery, but when you have surgery, 9 times out of 10, you can eat after surgery. They just want to make sure your gag reflex is back so you don't choke and aspirate. So, but of course with bariatric surgery, you can't have solids until like week 5, I think, 5 or 6. So I think the first 2 weeks you got to do the full liquids. Is it full of clear liquids here?
What?
You might want to lay down. Anyway, y'all, because she about to go to sleep, about to put her to bed, and I'm going to go home, because she is dozing on the side of the bed. She is dozing up on the side of the bed. So we will continue this conversation at a later time when she is feeling a little better, and hopefully she'll explain her journey or give you all some type of insight of what she went through emotionally, physically, mentally at a later time. So anyway, until then, I will talk to y'all later. So guys, I am leaving the hospital. Hopefully y'all can hear me. I forgot to tell y'all, the recovery time is per patient basis. So you may heal faster than the next person. So it's not typically good to go based off of somebody else's progression, because you may not have all the nausea and vomiting like her. But yeah, it just depends on the person. So she has up to 6 weeks off, but she might not need 6 weeks. She might want to do just a month, but it just depends on the recovery time. So that is something too. If you have to work, just ask your manager how long you can have off, or ask your doctor how long recovery may be. So yeah, that's something to look into as well. Hey guys, welcome. So this is just an update of my friend's vertical sleeve gastrectomy surgery. As y'all can see, in the last time I picked y'all up, I was actually in the hospital with her. She was a few hours post-op, and a lot has kind of sort of happened from the last time I talked to you guys. So I just want to keep you guys updated in the event that you have had the weight loss surgery, or you're getting or considering getting a weight loss surgery, or you know somebody that is getting the weight loss surgery or have had the weight loss surgery. There are different types of weight loss surgery. You have the bariatric, you have the sleeve, it's just different types. So we won't go into, this video is not to go into the different types of weight loss surgeries. This video, excuse me y'all, this video is just to give you all basically my friend's journey in her weight loss surgery. So today is Thursday, January the 18th, 2023. She had her surgery Monday, January the 9th, 2023. So she is a little over a week post-op, not 2 weeks yet. So let's talk about the tea. So I told y'all when we was there, if you go back, if you have seen, of course you have pretty much seen what had happened before when she was in the hospital. She was nauseous, and You know, everything was going a little bit as expected because she was post-op, so not too much out of the norm happened. Of course, as you all know, my earlier career, my nursing journey, I was a post-bariatric surgical nurse. So I also had bariatric patients, but the way we did things back in 2016, 2017, it kind of sort of has changed. There are different doctors, different practices. So of course, a lot has changed. Not a lot has changed, but doctors do things differently. But anyway, and when I had when I had the bariatric patients that came from surgery, I mainly had them overnight because the next day would go home. They were just there for 24 hours observation, pretty much. So my friend was there for 24 hours observation. She was able to get discharged. She had passed her fluid test, and the fluid test is basically you have to drink the medicine cups I had showed y'all. You have to drink a full cup every 15 minutes for 4 hours in order to go home, and you have to be able to keep it down. Now, being nauseous is expected. You're going to be nauseous, you're going to be vomiting, but because you're not getting the fluid that you need, it is a requirement and it's very necessary that you are able to keep those liquids down. You start off with the clear liquid, because you could do sugar-free popsicles, you could do Crystal Light packages, the mixed packages, and you can do water, of course, and you can do broth, very diluted broth. You don't want nothing too heavy in your stomach because it can definitely cause you to be nauseous. Now, in the hospital, she was getting, so when she could not keep nothing down, basically they had gave her like Dilaudid for the pain, because sometimes you don't know whether it's the pain that's making you nauseous or you're nauseous because there's so much going on at one time that you're just like, I'm nauseous, I'm in pain. But sometimes if you can control the pain, you won't be nauseous, or if you control your nausea, you won't be in so much pain. Because if you think about it, when you're throwing up and you have nothing to throw up, you're dry heaving, you're using your abdominal wall and your abdominal muscle to help get that up, and there's nothing to come up. So that's making it even more painful because you're squeezing. Just imagine doing a lot of crunches. You're like, oh, my stomach's sore. Just imagine doing that, and instead of your stomach sore, they done took 80% of your stomach out. You have all these laparoscopic incisions in your stomach. So it can be a little bit uncomfortable, a little bit sore, a little bit painful because of the vomiting and the dry heaving. Anywho, so when she got discharged, she was still throwing up, couldn't keep nothing down. And then I want to say Wednesday night, she just kept feeling like Tuesday night, she kept feeling like she couldn't keep nothing down. She felt like she was having a little bit of shortness of breath. Because when I would talk to her, she was like breathing fast. She couldn't talk and stuff like that. So I asked her, was she having a chest pain? Like, what was she experiencing? Excuse me. And basically she was like, she just couldn't keep nothing down, and it was kind of radiating to her chest. Excuse me. So for my nursing assessment, my nursing judgment, I felt like she was maybe having like an anxiety attack, or like she was very anxious, or she was having some type of panic attack, because she exemplified the symptoms of somebody that's having a panic attack, because you just had major surgery and so many thoughts are running through your head. You start to have second thoughts about it, but there's nothing you can do because the surgery's already done. So I felt like she was maybe having a panic attack. And so on Wednesday, January the 11th, around 2 a.m. Wednesday, she went to the emergency room, where she went because she was having a little chest pain. She got a little scared, where when she said she had chest pain, they not admitted her, but they took her to the back right then and there. They did several different testing. So when you go to the ED, one quickest way to get you seen is to say you have chest pain. And she been in healthcare as well. She knew that would get her in the back soon, very fast. So of course, her saying she had chest pain, and then she's post-op bariatric surgery. They just want to make sure everything was okay. So with all that being said, they did what they do. They did labs. They did several labs, just a regular CBC BMP. We won't go into like what the labs are for, but I just want to let y'all know what they did. So they did CBC BMP, blood cultures, and all that stuff turned out within normal limits. I have my notes right here, y'all. That's why I'm looking down, because I want to be very informative, but not too informative, because everybody journey is different, but I do want to just to let y'all know what she experienced and how she's doing. So they did lab work, several lab works, all that stuff came back normal. They did 2 EKGs that came back. I think one of them came back a little abnormal because of the shortness of breath and the chest pain she was having. So of course it kind of sort of reflected on the EKG, but when the cardiologist had looked at it, it wasn't concerning to him. It did show that she had, I think the abnormal part about it, she was sinus bradycardic, which she had a low resting heart rate. An adult's heart rate is supposed to be anywhere from 60 beats per minute to 100 beats per minute. Anywhere between that threshold is okay. Of course, the more activity you do, the higher your heart rate is going to be. But because she was so anxious and she was throwing up, they were still amazed that her heart rate was in the 50s. So, you know, that was concerning because when she had, you know, when you're post-op stuff, you're supposed to get an echo done. Y'all gotta take this off my head because I have a headache, y'all, and this is definitely, I think, exaggerating my headache. So sorry guys. But anyway, when you're post-op, you're supposed to get cleared by a cardiologist, and the cardiologist cleared her because everything was within normal limits. But when they did two EKGs, one came back at normal, one came back within the fine limits because her heart rate was so low. Her heart rate was like in the 50s. But some people have low resting heart rates, because y'all know when I had my situation with my 24-hour test and this and the forth, if you're true, you would know. My resting heart rate is in the 50s as well. So some people have a low resting heart rate, especially maybe you're active, maybe you work out a lot, whatever the case may is, you're an athlete, you exercise a lot. It's normal to have a low resting heart rate. And if you're on any type of meds that vasodilate your muscles, you're going to have a low resting heart rate, like beta blockers or some type of ACE inhibitors. Anything that would lower your blood pressure, you may have a low resting heart rate. Now, some blood pressure medications will raise your heart rate. Anyway, that's a whole nother topic. That ain't what this is for today. So she did a chest x-ray because she was having a chest pain, and the chest x-ray came back normal. They then gave her Dilaudid, which kind of knocked her out. Dilaudid is one of the stronger pain medications that we have on the med-surg floor. So in the ED. Now, when you go to fentanyl and all the stuff like that, that's a whole different type of pain medicine. On the med-surg floor, we do not give fentanyl. I know in like PACU settings and ICU settings, they give fentanyl, but not on regular med-surg stable floors. She got Zofran, but Zofran did not help a lot. A lot of people feel like Zofran does not do the trick. She had the patch behind her ear. She had 2, there was alternatum. She felt that did not do the trick either. And they gave her something for gas. I forgot what they did. I forgot what they gave her for gas. And I know she had they gave her Tums. They tried to give her, what did they try to get? They tried to give her something else to see if that can kind of soothe her stomach, but it did not. They also did a blood gas on her, which they took arterial blood through her arterial vein, her artery. And basically the gas, it tested your CO2 levels and your basically your metabolic level and your alkaline and stuff like that. And everything came back fine except for her oxygen was reading at 92%. Now, you all know your oxygen is supposed to be anywhere from 95 to 100% oxygenation. Anything below that is of concerning. But of course, if you like a COPD patient, or you have some type of respiratory issues, and maybe you have a lower O2, which a COPD patient, you don't want them to be above a certain amount, a certain percentage, like 88, 90, 92 is okay for a COPD patient. But a patient who has no history of COPD or stuff like that, you want to be saturated 95 and above. Whole nother topic, okay? But that just goes to show how everything is kind of sort of intertwined with each other, how everything kind of sort of flows and works together. And if you're new to this channel, or if you're a new nurse or new grad or you're nursing school, I promise y'all, it may be confusing now, but once you have been I've been a nurse almost 7 years. Once you have been a nurse, everything the dots start to connect, and you'll understand, oh, this works because of that. I promise y'all, It's going to be confusing at first, and you're going to feel like you've just been a task nurse. But as the years go by, the more experience you get, the better your critical thinking skills will be. And, you know, I have always worked at a level 1 trauma center in a NICU and in med-surg. I've always been a level 1 trauma center. So that's what kind of helped me build my skills as well. And the foundation I have when it comes to my knowledge. Anywho, another topic, y'all. Let's get back on topic. Okay, so they admitted her because she couldn't keep nothing down. She was still experiencing chest pain, and they just wanted to once again observe her. So her surgeon, who she absolutely loved, her surgeon that did her bariatric surgery, she was with her the entire hospital stay. She got admitted on the 11th of last Wednesday, and she just got discharged this past Wednesday or this past Tuesday. So she got discharged like around the 16th or 17th, something like that. She almost stayed a week in the hospital. She was miserable because she couldn't keep nothing down. And at that point is when she was having a few regrets. But I told her, you know, this is kind of normal. You know, I have another friend. 95% of my friends are nurses and or in the medical field, healthcare workers. And I have a friend who is a not so long ago pre-post nurse, and she used to get bariatric patients as well, and she said that's very common. And me being a post-surgical trauma nurse, just anesthesia period, once you come from that, a lot of people have a side effect of anesthesia, and it's called nausea and vomiting. That is definitely a symptom or a reaction, I should say, to anesthesia. So just be mindful with any surgery you get, you could have a reaction of nausea and vomiting for a couple of weeks, a couple of days until it finally calms down. Girl, get it out. But yeah. So she said the incision where they put on her stomach was a little sore, but she said she wasn't in pain. She said she did not have any pain. She did not take her pain medicine. The medicine that she had to get prior to surgery was Percocet, which is the pain medicine. I think she had the 5 to 325 because you have the 5 to 325 or the 10 to 650, I believe. And I think she had the lower amount because whatever. And she got Tylenol. She got some Dococet, which is a stool softener. And I don't think she got antibiotics. She did get a Lovenox shot because you have to take Lovenox injections 7 days post-op where her doctor, this is what her doctor wanted her to do. So like I said, every surgeon is different, but she had to take Lovenox, which is a blood thinner, and that's just to help to prevent blood clots after a surgery. And you know, you also need to walk around to keep that blood circulating, to keep that blood going. So she had to get all that stuff done and to get all that stuff. But other than that, her stomach was a little bruised because of the Lovenox injection. So when you give yourself Lovenox injections, be sure to rotate the sites, because if you do not rotate the sites, I'm not gonna say the name because y'all can be like, what is that? For my non-medical people, and even people who are medical, but you're not working in med-surg or you're not used to Lovenox injections, because I work in NICU and my NICU nurses don't know what the heck a Lovenox injection is. But basically, like I said, it's to prevent blood clots, and if you keep hitting the same spot, it's going to bubble up, and it's not a nothing life-threatening, but it can just bubble up, be very uncomfortable, and it could take a long time to heal. So I don't know why I'm pointing to my arm, because with a Lovenox injection is a sub-Q injection. You give that in any fatty part of your body. So behind the arm, the front of the thighs, or the back of the thigh, your butt, and the meaty part, and your stomach, of course. Typically, you want it in the stomach, and just rotate the sites. Rotate the sites at all times. And if you rub it, because it is a blood thinner, when you rub it, you can bruise. So just be aware of that. Don't be too alarmed if you're taking your blood thinners and then the spot where you inject yourself at, it becomes black and blue and purple. That is a very common. It does go away for most people. It may stay there a little while, but it definitely goes away over time. So anyway, so during her hospital stay, they was giving her Zofran and Phenergan. Phenergan is a strong antiemetic drug, which helps to it helps with the nausea and the vomiting, and none of that worked. So then it put her on volume. Volume, it can help with the pain. Volume has different type of actions, and that's why I say I don't like telling people what medications are for, because every medication work differently. Like Volume, it can be an antipsychotic med, but then again, it worked because and you know, when it comes to anxiety, depression, that is a mental disorder, of course. So with the volume, it helped with her anxiety. It helped to calm her down a little bit, because once they seen that nothing was out of the ordinary as far as her labs, as far as her numbers were concerned, nothing was concerning. But her physical presentation, you could tell something was going on. You could tell something was off. But because they couldn't pinpoint what it was, because they literally did everything. They did an upper GI because she couldn't keep nothing down. The upper GI came back fine. They did a barium swallow. Like, everything came back fine. Her labs, her tests, under that came back fine. So that's when they tried to put her on different meds to try to calm her down. So they put her on the volume, which works for anxiety and also with nausea. And then that kind of sort of didn't work. So they gave her Reglan. Reglan is also an antiemetic. It's supposed to help with the nausea and the vomiting. And once she started getting her doses of Reglan, she started to feel a lot better. So at that point, so we're now talking, this is maybe Friday of last week when they started the Reglan. So Friday, Saturday, Sunday, Monday. So Monday, she started to feel a lot better, you know, still kind of sort of dry heaving, but she was able to keep some fluids down, because at this point she had to get back on the IV fluids because she wasn't keeping anything down. So let's say now Monday comes, which is the Martin Luther King Day. Monday is now here. This past Monday is now here, and she's feeling maybe 60% better. So the doctor came around, they did some more lab work. They repeated every test they done when she was first readmitted, and everything was still showing the same results. So because of that, they were not concerned. And it was like, you know, this is just something that you're gonna have to get through. Unfortunately, you hate to tell a patient, you're just gonna have to get through it, but unfortunately, you're just gonna have to get through it. So this is a situation where she just had to get through it. So they still discharged her with Reglan. So because Reglan kind of helped, and it wasn't necessarily pain, and it wasn't anything else like cardiac wise, it was literally anxiety. And which, if y'all know about panic attacks, it can mimic a little MI or a little small heart attack, because you get a chest pain, you get a shortness of breath, you feel like you everything is caving in on you. But think about it, you just had a major surgery, you having second thoughts. You don't know what the outcome. You're anxious because maybe it's a good thing. You're anxious because you can't wait to lose your weight. You're so excited to see the new you. So just a lot of emotions are going in at one time, which is it's normal and it's okay. So they gave her Reglan to help keep her calm with the nausea and vomiting. And even before she got discharged, she still had to do the drink test, and she had to pass the drink test. So going back to when she was originally discharged or admitted after surgery, after the bariatric surgery, just like she had to drink the medicine cups, full medicine cups, every 15 minutes for 4 hours, before they discharged her this time, she had to do the exact same thing. So within the hour when she first started it, she threw up. So that she had to restart. So they're going to keep restarting you until you can keep, I mean, if you spit a little bit, that's okay. But she threw up like maybe 2 or 3 times within the first hour. So of course she had to restart it. So then it's a matter of you figuring out what is causing you to become nauseous. Maybe you can't tolerate sugar-free pudding right now. Maybe you can't tolerate popsicles or a fruit punch flavor or a lime flavor. Maybe you just have to figure out what you can tolerate on your stomach, being that you haven't eaten anything. Your stomach went from being this big to now this big. So you really have to, it's a matter of you figuring out yourself at that point, to be honest. What can aggravate the nausea and vomiting episode? So you just have to really figure that out, unfortunately. But yeah, so she eventually passed her drink test, where she was able to keep down all her liquids, where she had the broth, and she had water, and she had popsicles, she had Jello. So she was able to tolerate that. The Jello didn't sit too well on her stomach, so she didn't really eat the Jello, but everything else she did have, and she was just sipping or whatever. Not one time did she become lightheaded or dizzy. Drinking my Lonnie New Crush. What is this? Cherry Slush, sorry. Not one time, which is a very good thing, not one time did she become lightheaded, or did she pass out, or did she faint. You would think by you not eating, you're not drinking, your body is like going through this big change that you will become lightheaded and dizzy. Not one time did she do that. I can say during the second hospital stay, her blood pressure was like the low 80s over 50s, which they gave her a bolus. But that's kind of expected that you have low fluid volume because you're not drinking any, you're not eating anything. And she had just got admitted, so of course they had to get her the fluids, get her bolus to get her fluid volume up. So other than that, she was discharged, and she was discharged on Tuesday. Wednesday, she was like, yeah, when I talked to her yesterday, y'all, she was like a whole different person. She was like positive. She want to book her a trip. I probably going to Jamaica, y'all, but she want to go to Jamaica. Like she want to do, like when I talked to her, she was doing really good. I supposed to be taking a trip with her that she want to plan. So stay tuned with that, because that trip is coming this year as well. She's doing so well. She's talking. She's herself. She's positive now. She is excited for the future. She's excited for her weight loss journey. She does not get nauseous as much as she was. She's on her meds. She says she's still not in pain. She said the part where they took her incisions out, it's a little painful, which I'm gonna ask her, is it okay if I could insert a picture? And of course, if she said yes, I'm gonna put the picture right here. But you can see the laparoscopic. If she allow me, I'll show y'all. But anyway, the laparoscopic, and I think she had like 6 incisions closed with skin glue, and they healed properly. She said it was a little itchy, and the doctor recommended some cream to put on top of them because they did get a little dry. They started to itch a little bit, but other than that, she said the only part that was sore, it wasn't even pain, it was just sore, was a part that they took the stomach out of. She said other than that, she has been fine. It has really been nothing but her being nauseous or her throwing up. That is it. She said that's the only downside about it. And because of that, she had regrets. She said, but now that she's pretty much back to normal as far as like feeling like herself again, and she's not nauseous and she's not vomiting. She has spurts where she get a little bit nauseous, but once again, that's when she ate something that her stomach did not agree with. So she'll be 2 weeks post-op on this upcoming Monday, where she's still on a full liquid diet. She have her post-op appointment next week as well, where the doctor will determine the next stage of her diet, which I think the next stage is soft protein. And I'm not sure what soft protein consists of, because soft protein is a bariatric diet, which I think is like maybe a parade diet, which is different from a parade diet, but it kind of sort of is parade diet. But like I said, when she goes to her doctor next week and she update me on everything, then I would definitely be able to tell y'all what her next diet is, being that at that week she'll be 2 weeks going into her 3rd week post-op, and she has not taken her vitamins. That's another thing. Excuse me, I don't know if this is common, but I never followed a person on a bariatric surgery diet. I've always had them post-op. Excuse me, never discharged them because of course I work nights. But yeah, she cannot take her vitamins until her doctor gives her the okay. And basically, you know, it's a lot of vitamins you take post-operatively. And a lot of those vitamins have coats up there that can agitate your stomach. Just thinking about taking a vitamin on an empty stomach. At the end of the day, you're still not eating. You're still not getting what you need to kind of sort of help coat your stomach so it can absorb the pill. So with taking all those vitamins, it can be very not dangerous to the stomach or the gut or the GI system, but it can make you throw up. So I just want to make sure that she's tolerating all her liquids first before she take her vitamins. Anyway, y'all, if y'all have any questions, please don't be afraid to message me, email me, or drop a comment down below. I'm on Instagram as well, Unapologetically Nita. You will probably hear from me the fastest on my IG. So if you haven't already followed me, go over there and follow me on IG. If you haven't already subscribed to this channel, subscribe. Anyway, I'm gonna close this vlog out. This is part 1 of the weight loss surgery. Hope this is very helpful. Like I said, if you have any questions, let me know. And this information came exactly from my friend. Her experience came exactly from her. And I'm just giving y'all a little bit more because I have had bariatric patients post-operatively, and I am a nurse. So I kind of sort of can help y'all try to figure out some stuff. Anyway, y'all, it's Like I said, make sure you subscribe to this channel. Make sure you leave some comments down below if you have any questions. Please don't be afraid to ask. And I'll pick y'all back up in part 2.
Gotta know, 'cause your time is money.